anaphylaxis, which is a severe, potentially life-threatening allergic reaction. It can occur within seconds or minutes of exposure to something you are allergic to, such as peanuts or bee sting. Well, it causes the immune system to release a flood of chemicals that can cause you to go into shock. Blood pressure drops suddenly and the airways narrow, blocking breathing. Signs and symptoms include a rapid weak pulse, a skin rash, and nausea and vomiting. Common triggers include certain foods, some medications, insect venom, and latex. Anaphylaxis requires an injection of epinephrine and a follow-up trip to an emergency room. If you do not have epinephrine, you need to go to an emergency room immediately. If anaphylaxis is not treated right away, it can be very fatal. Okay. Earlier on this channel, I have already uploaded a short video about anaphylaxis. I hope you have already seen that, and today I am going to discuss this emergency situation in detail. Well, first of all, let me tell you the symptoms. Anaphylaxis symptoms usually occur within minutes of exposure to an allergen. Sometimes, however, anaphylaxis can occur a half hour or longer after exposure. In rare cases, anaphylaxis may be delayed for hours. Signs and symptoms include skin reactions including hives and itching and flushed or pale skin, low blood pressure, that is hypotension, constriction of the airways and a swollen tongue or throat which can cause wheezing and trouble breathing, a weak and rapid pulse, nausea, vomiting or diarrhea, dizziness or fainting. You should seek emergency medical help if your child or someone else you are with has a severe allergic reaction. Do not wait to see if the symptoms go away. If you have an attack and you carry an epinephrine auto-injector, administer it right away. Even if symptoms improve after the injection, you still need to go to an emergency room to make sure symptoms do not recur, even without more exposure to the allergen. This second reaction is called biphasic anaphylaxis. If you or your child has had a severe allergy attack or signs and symptoms of anaphylaxis in the past, the diagnosis and long-term management of anaphylaxis are complicated. So you will probably need to see a doctor who specializes in allergies and immunology. I mean, if you have a history of previous attack, you should see a doctor in that case, because this problem of severe allergic reaction can take place again. Okay, so better to go for a long-term management and discuss your situation with your healthcare provider. Okay. Now let me tell you the causes. The immune system produces antibodies that defend against foreign substances. This is good when a foreign substance is harmful, such as certain bacteria or viruses, but some people's immune system overreact to substances that do not normally cause an allergic reaction. Allergy symptoms are not usually life-threatening, but a severe allergic reaction can lead to anaphylaxis. Even if you or your child has had only a mild anaphylactic reaction in the past, there is the risk of more severe anaphylaxis after another exposure to the allergy-causing substance. The most common anaphylaxis triggers in the children are food allergies such as to peanuts and tree nuts, fish, shellfish, wheat, soy, sesame, and milk. Besides allergy to peanuts, nuts, fish, and sesame and shellfish, anaphylaxis triggers in adults include certain medications including antibiotics, aspirin, and other pain relievers available without a prescription, and the intravenous contrast used in some imaging tests. Stings from bees, yellow jackets, wasps, hornets, and fire ants. Latex. Although not common, some people develop anaphylaxis from aerobic exercise such as jogging or even less intensive physical activity such as walking. Eating certain foods before exposure or exercising when the weather is hot, cold, or humid also have been linked to anaphylaxis in some people. You should talk with your healthcare provider about precautions to take when exercising. If you do not know what triggers an allergy attack, certain tests can help identify the allergen. In some cases, the cause of anaphylaxis is not identified, and that is known as idiopathic anaphylaxis. Now I'll tell you some risk factors. There are not many known risk factors for anaphylaxis, but some things that might increase the risk include previous anaphylaxis. If you have had an anaphylaxis once, your risk of having this serious reaction increases. Future reactions might be more severe than the first reaction. Allergies are some people who have either condition are at increased risk of having anaphylaxis. Well, on this channel, I have already posted a video about allergic dermatitis. That is very informative video. You can see that video. Okay. Then there are certain other conditions. These include heart disease and an irregular accumulation of a certain type of white blood cells, and that is known as mastocytosis. Okay. Coming to the complications, an anaphylactic reaction can be life-threatening. It can stop your breathing or your heartbeat. So this is really dangerous. Now I'll tell you some preventive measures. The best way to prevent anaphylaxis is to stay away from substances that cause this severe reaction. Also, you should wear a medical alert necklace or bracelet to indicate you have an allergy to specific drug or other substance. Keep an emergency kit with prescribed medication available at all times. Your provider can advise you on the contents. If you have an epinephrine auto-injector, check the expiration date and be sure to refill the prescription before it expires. Be sure to alert your providers to medication reactions you have had. If you are allergic to stinging insects, you use caution around them. Wear long sleeve shirts and pants. Do not walk barefoot on grass. Do not wear bright colors. Do not wear perfumes, colognes or scented lotions. And do not drink from open soda cans outdoors. Stay calm when near a stinging insect. Move away slowly and do not slap at the insect. If you have food allergy, carefully read the labels of all the food you buy and eat. Manufacturing process can change, so it is important to periodically recheck the labels of foods you commonly eat. When eating out, ask how each dish is prepared and find out what ingredients it contains. Even small amounts of food you are allergic to can cause a serious reaction. You should also be prepared. Even if you are careful, at some point you will likely be exposed to what you are allergic to. Fortunately, you can respond quickly and effectively to an allergy emergency by knowing the signs and symptoms of an anaphylactic reaction and having a plan to quickly treat those symptoms. Okay. Now I will tell you about the diagnosis. Well, when the patient comes to us, we might ask you questions about previous allergic reaction, including whether you have reacted to particular foods, medications, latex, insect stings. To help confirm the diagnosis, you might be given a blood test to measure the amount of a certain enzyme, that is tryptase, that can be elevated to up to 3 hours after anaphylaxis. You might be tested for allergies with skin tests or a blood test to help determine your trigger. Many conditions have signs and symptoms similar to those of anaphylaxis. Your provider might want to rule out other conditions. Now coming to the treatment. During an anaphylactic attack, you might receive cardiopulmonary resuscitation, that is CPR, if you stop breathing or your heart stops beating. You might also be given medication including epinephrine, that is adrenaline, to reduce the body's allergic response. You will be given oxygen to help you breathe. Intravenous antihistamine and cortisone injection to reduce inflammation of the air passages and improve breathing can be given. A beta agonist such as albuterol to relieve breathing symptoms. Now I'll tell you what to do in an emergency situation. If you are with someone who is having an allergic reaction and shows signs of shock, act fast. Look for pale, cool and clammy skin, a weak, rapid pulse, trouble breathing, confusion and loss of consciousness. You should do the steps which I am going to tell you. You should call your emergency number for medical help. Use an epinephrine auto-injector if available by pressing it into the person's thigh. Make sure the person is lying down and elevate the legs. Check the person's pulse and breathing, and if necessary, administer CPR or other first aid measures. Now I'll tell you how to use an auto-injector. Well, many people at risk of anaphylaxis carry an auto-injector. This device is a combined syringe and concealed needle that injects a single dose of medication when pressed against the thigh. Replace epinephrine before its expiration date, or it might not work properly. Using an auto-injector immediately can keep anaphylaxis from worsening and could save your life. Be sure you know how to use the auto-injector. Also make sure the people closest to you know how to use it. Now I'll throw some light on long-term treatment. Well, if insect stings trigger an anaphylactic reaction, a series of allergy shots, that is immunotherapy, might reduce the body's allergic response and prevent a severe reaction in the future. Unfortunately, in most other cases, there is no way to treat the underlying immune system condition that can lead to anaphylaxis, but you can take steps to prevent a future attack and be prepared if one occurs. Try to stay away from your allergy triggers. Carry self-administered epinephrine during an anaphylactic attack. You can give yourself the drug using an auto-injector. Well, this was my video about anaphylactic reaction or anaphylaxis. I hope you like this video. If you have any question about anaphylaxis, you can post in the comment section.